Law matters to public health. And let's start by thinking about how big law is. When we talk about law, we're not just talking about statutes or court decisions, what you might call law on the books. We're talking about all those institutions and people and practices through which law is enforced. So when you're out on the streets, the law is what the policeman says, or the law is what the government bureaucrat says. These forms of law are all over the place, and they're influencing our behavior and our environments in countless ways all the time. The law is basically one of the biggest social intervention systems we have. After all, we pass laws to influence behavior and change environments. And behavior and environments is what public health is all about. In our program, we look at 3 different kinds of public health laws. Interventional public health law is comprised of all sorts of laws that are being used explicitly and deliberately to influence behavior or environments to make us healthier. For example, a law requiring people to wear seatbelts, or a law that prohibits new drivers from driving past 11 p.m., or environmental protection laws that prevent the release of toxic substances into our environment. Interventional public health law is law used to intervene to protect public health. A second category we're interested in is called infrastructural public health law, the law that sets the powers and duties and jurisdictions of health agencies in health systems. For example, some state laws create a statewide health system with one statewide health department, and you don't really have big local health departments. In other states, you have local health departments and no big state health departments. These are variables that change from state to state, and they may make a difference in how well those health departments function. So infrastructural health law is the study of how the basic powers and duties enshrined in law influence the outputs of health departments to make a difference for our public health. The third and biggest category of law we're interested in is what we call incidental public health law. Take civil rights law. Law that protects us from discrimination in the workplace because of our gender or our race or because of a disability. You can see that as just being about equality. But the fact is that workplace hierarchy, happiness, relationships turn out to be very important to people's long-term health. People who work in workplaces where they're respected, where stress level is kept low, where they have a chance to take control of their work, they seem to have better health outcomes than people in other kinds of workplaces. So suddenly the law that structures workplace relations is actually important to health. It's not intended to be, but incidentally, it has that effect. That's part of what we want to study in public health law research. We're lawyers, epidemiologists, criminologists, sociologists, anthropologists, psychologists. We're people who want to bring to bear the best of the scientific method and the best understanding of how law works to figure out how laws and legal practices influence public health. Our goal is to promote the use of law in an effective way to promote public health. Law can be an efficient, even cheap kind of intervention that has a powerful effect on behavior, environments, and health outcomes. When it works, every state should do it, every jurisdiction should do it. Of course, law can also be a waste of time, an annoyance, a pointless expense, an unnecessary regulatory burden. Law doesn't always work, and when it doesn't work, we shouldn't use it. But how do you know the difference? Through public health law research. We measure the effects, we figure out what's working and what's not, and we try and get it out to policymakers and the public. We define public health law research as the scientific study of the relation of laws and legal practices to population health. This diagram depicts the dimensions of public health law that we're interested in. We start with the policymaking process, through the creation of the laws, the implementation of those laws, the effects those laws may have on individual behavior or on environments, and finally to the question of what actual effect these laws have on public health outcomes. How do we do this? We fund academic researchers, researchers in public health departments and other government agencies. We fund teams of people who have legal and research expertise to do the best possible work. We fund research, but we also try and make research better. We do this by providing technical assistance to the people we fund and to other people interested in doing public health law research. by bringing people together from different fields to work together, by commissioning research and papers that examine pressing public health law research needs, by developing better methods for public health law research. We work to disseminate the results because merely doing the research and putting it on a shelf makes no difference to public policy and to the health of the population. So we're working with our grantees and with the Robert Wood Johnson Foundation to make sure that when we learn something important about the law, it gets out into the public debate. Our program is based on the proposition that a country, a state, a city that pays attention to the facts is going to make better decisions than one that doesn't. When we struggle with the question of how to improve health most effectively, most efficiently, we should know when law can help and when it can't. Our job is to put that evidence out into the debate, and oftentimes it makes a big difference. We hope that you'll join us by doing public health law research, by consuming public health law research, by using public health law research in your public policy advocacy and lawmaking efforts. Thanks very much.